the pandemic swept through the mill, infecting an estimated 400 people, about 10% of the workforce. Walter James Morton, a 26-year-old fireman, and John J. Grady, a 37-year-old plumber, were the first two victims in Hopedale to succumb to the virus.
In 1918, a pandemic devastated our community, and people came together in remarkable ways. Generations have hoped we would never experience such a challenge again. As the sun rose on 2020, Milford Regional Healthcare System was filled with hope and vision. A new Level 1B continuing care nursery was on the horizon for families whose babies needed specialized care at birth. An intense goal-driven focus on quality throughout Milford Regional was manifesting in palpable ways. Along with the reemergence of grand rounds, the development of peer review committees, and strong recruitment efforts, these initiatives were attracting even greater numbers of fine physicians to our healthcare system. For years, Milford Regional leadership had been conducting disaster drills, ensuring preparedness for any disaster that might arise. On March 10th, Governor Charlie Baker declared a state of emergency as COVID-19 cases in the state were increasing. The drills became reality, and the Milford Regional team stood ready to put their well-executed plans into action. Inside our walls, Milford Regional President and CEO Ed Kelly and his management team, along with infectious disease specialists, Drs. Neustein and Sarpel, and an incredible, wide-ranging team of hospital personnel, activated Milford Regional's disaster plan. The command center became central to around-the-clock oversight as care, treatment, and supplies were constantly monitored and adjusted based upon the latest information and needs. Ed noted the extraordinary commitment and effort being made on a daily basis by everyone within the healthcare system, with a weekly email that personally recognized the challenges being faced and expressing gratitude for their dedication and resolve in caring for our community. In the face of a worldwide pandemic, the strength and determination of our healthcare system to deliver exceptional care to a community in need was on display every hour of every day. Milford Regional Physician Group quickly embraced telehealth, providing important face-to-face care for their patients in a safe and reassuring environment. Their 4 urgent care sites took on critical importance as they managed care at different locations for patients with and without COVID symptoms. They also provided the community with much-needed COVID testing. At the hospital, everyone's focus was on meeting the needs of a mounting number of admitted COVID patients, as well as ensuring the safety of our staff. Their unrelenting dedication to patient care and supporting one another were evident everywhere. All have been true warriors in the fight to defeat COVID-19.
Every nurse has that moment. I've heard it hundreds of times. Someday something will hit you so hard that you'll get out to your car and you'll just sit there and cry. And I never believed them. Or maybe I thought I would be too strong, or would be the tough guy that I clearly am not, because that day came. I let it build day after day, week after week, months into the COVID-19 crisis. I got in the car after a 12-hour shift, and I thought about my grandfather when he passed away in the ICU at UMass a few years ago, and how awful it would have been if I couldn't have been there, holding his hand, and I cried.
Outside our walls, it seemed that a wave, a miracle, was building as members of the community, teachers, school children, restaurants, businesses, moms and dads, first responders, and grandparents, created ways to let the Milford Regional team know that we are all in this together. Groups would show up to cheer on our nurses. First responders from dozens of communities organized a tribute train of fire trucks, police cruisers, and other emergency vehicles to parade by Milford Regional. Staff were encouraged by the thoughtfulness of school children who created handmade thank you cards and posters that were put on display throughout the campus. Area businesses delivered incredibly generous donations of food and supplies to support the hospital's needs and fortify our staff during stressful shifts as they gave their all to provide our patients with the highest quality care. As the surge hit, Clancy, Maya, Oakley, and Dublin, a team of therapy dogs, were deployed to offer happiness breaks for our employees. Small offerings of gratitude stones showed up outside our walls to express the heartfelt support of the community. It was a true celebration when our first intubated COVID patient was discharged. He left Milford Regional to a chorus of applause, offering his own gratitude to our caregivers. The beginning of a precious tradition that has continued for others who have recovered and made their way home.
In the 3 weeks I've been here, I got to meet a lot of you, and I've been genuinely impressed by the care you give me and the risk you're willing to take, to do this, every single day. I know you guys got families too, you got to go home too. And it can't be easy. It really can't. And I always felt that you guys were able to somehow put that fear aside and, just care for me like you. I was one of your own. It really means a lot to me. Thank you.
The outpouring of love and support from the community has lifted up the entire Milford Regional Healthcare System team and strengthened our resolve. This past year has demonstrated that both the hospital and physician group are more than prepared to take on whatever challenge that lies ahead. Coretta Scott King once said, "The greatness of a community is most accurately measured by the compassionate actions of its members." If that is true, our community, in its caring for each other, as it did more than 100 years ago and again in 2020, is truly a picture of greatness.